Many of us who follow Faster EFT know Dr. Eric Robbins from Los Angeles, a respected urologist who for years has integrated classical EFT and other forms of alternative healing into his medical practice. About a year ago, he discovered Faster EFT and became very active in the community. Thanks to him, Faster EFT reached the west coast of the USA. You can find many of his videos on YouTube, and he also gave us a very interesting, actually truly amazing, interview for my Faster EFT seminar. Here, I'd like to share some of his medical insights on pain, especially pelvic pain and menstrual pain, from his daily practice with patients, where he often uses Faster EFT sessions instead of prescribing painkillers. Eric Robbins is also known for treating patients referred to him by colleagues who considered their cases unsolvable. In the words of Dr. Eric Robbins, from my experience with most illnesses, it's not like God is looking down saying, I'll give John this disease for no reason. What I know for sure is that when people are sick, there is usually some kind of stressor, or it was preceded by a negative event. Because looking at that memory is too painful, people unconsciously store it in the body to keep it out of sight of their conscious mind. They often tighten skeletal and other muscles for days, weeks, months, years, or even decades. Muscles can remain in this contracted state for a very long time, leading to poor blood flow and reduced oxygen supply. Did you know that lack of oxygen makes cells many times more likely to become cancerous? This can cause severe pain. These tight muscles also compress the nerves passing through them, sometimes causing nerve dysfunction, where the nerve becomes either hypersensitive or almost completely numb. For many of my patients with pelvic pain, these observations are exactly confirmed. I can say that no one has stubborn chronic pain like my last patient had, without an unresolved memory that they are still holding inside. She had denied a past experience of abuse. From my clinical experience, and I say this without judgment, many women who have had an abortion still carry immense psychological pain and guilt. When I asked this patient about it, as Robert Smith, the founder of Faster EFT, says, we hit water. A flood of tears came. We used tapping to clear the emotional charge from the memory. My view is that as the muscles release, blood, oxygen, and energy can flow better, initiating healing. When muscles relax, they stop compressing the nerves, and nerve hypersensitivity improves. That's what I do every day in my medical practice, many times a day. Some patients are also dissociated from their emotions, which makes them a bit more challenging. I know this very well because I used to be one of those cases myself. Dr. Eric Robbins, Los Angeles, California. The benefit of Dr. Robbins' insights is that many women suffering from chronic or recurring pain now have the chance to resolve their problems once and for all. It's enough to learn a few simple techniques and use them until the pain is gone, or work with a therapist who can often help them effectively.